let's talk about what the difference between holistic dentistry and
Sure.
conventional dentistry, just so we can get a clear picture of what is the difference.
Okay, so traditional dentistry is where you look at the mouth, and really there isn't a lot of difference, except that, my interest has taken me to study further in like acupuncture and reflexology, as you talked about, and craniosacral work, and I look at how the mouth and the body connect, maybe at a little bit deeper level. Like, for example, I took a very strong interest at one point.
I love what you're saying. Hold your thought. We're going to come
Okay.
back, and we're going to talk more on holistic dentistry when we come back. Discussing holistic dentistry. So before the break, we were discussing the difference between conventional dentistry and holistic dentistry,
Right.
and I'd love to continue to know the difference.
Okay, so we were talking about that materials. I research all the materials that I put in my clients' mouths or patients' mouths, and the reason why I say clients is because I like to work with my patients in a level of education and awareness. So materials, we research them to make sure there's no bisphenol A in there, the BisPA, right?
What is that?
Remember the baby bottle recall where they were concerned about bisphenol A in all the baby bottles and they had to take them all back? Well, the bisphenol A is sometimes used in other plastic materials.
Okay.
So if we're using resins, it could be there. We make sure that, there's biocompatibility for our patients. We go into a little bit more detail about people come to me who are environmentally sensitive, and we have to be aware and helpful for them to increase their quotient of wellness rather than creating a step down for them.
But you have the same level of education as any other dentist, just for people to know that.
I went to University of Toronto,
Yep.
and I've got my dental degree, but then I continue my continuing education. So I do 4 to 6 weeks of continuing education every year.
Great.
I'm always pushing the envelope, and I'm looking inside dentistry and outside of dentistry and into the wellness world as well, so that I can bring it all together. And so we look at materials. I believe that people ought to have their teeth to 120, and not only for us to have our teeth, but be able to make sure that they look as beautiful when we're 120 as we are today.
Amazing.
So, that's great. And we know how to do it today, so it's fantastic.
But you were saying cranial sacral therapy,
Right.
reflexology,
Yeah.
acupuncture. How
Right.
do you, so if I've done all these things,
Right.
but not in my dentist's office.
Okay.
So I'm curious, do I come in and have a treatment of reflexology and
Yeah.
acupuncture while I'm
Sure.
getting my teeth done?
Absolutely.
How?
Well, okay, so first of all, like say you came in and you said, I'm really nervous and I'd like to have laughing gas. And I would say, you know what, Stacey, I've got that for you. However, I can also offer you a little acupuncture, which is a heart 7, and it's a little point that goes in your wrist and it will chill you out and make you feel relaxed. Would you like to try that instead? And you might say, yeah, I'd rather have that, then I don't have to wait after my appointment before I drive, et cetera, and it's less chemicals in my body. It's creating the endorphin release from within to stabilize and neutralize myself. Or you may say to me,
That's
or we want
amazing.
other reflexology. One of my assistants is a reflexologist. So we have her come in and she works on your feet while I'm working on your mouth. And that creates a nice body energy flow. And you're relaxed. I can do my job better. And obviously the tension isn't stored within your body.
And how about the cost factor? Is there a cost now for
Right.
the reflexology and the acupuncture
No, we don't.
added
That's
on?
all included.
Okay.
Those are things that I just want to give you the full service
Okay,
of
so-
what I would want if I was coming to the dental office.
That's incredible. So like your insurance would cover that in the cost of the dentistry?
We don't charge for it,
Okay.
so I absorb that cost.
Okay.
Some of our fees are higher than normal because of the technology that we work with and the services that we offer. And we also have paraffin hand wax treatments too. So when you come in, you get to put your hands in nice warm paraffin. And some people say, I want a full body immersion.
I've never heard of this, so I'm really
It's
amazed.
fun.
I think it's incredible.
Yeah, well, people say to me all the time, like, I love coming to see you. Like, I'm so excited when I have my dental appointment and everyone else
like
looks
going
at
to
me
the
like
spa.
crazy. Well, it is. We give spa-like amenities because
Yeah.
I just want you to enjoy and celebrate smiles, and it shouldn't be a fear factor.
Yeah, I know how busy you are. I mean, you are incredibly busy. So, I mean, it's great. I think you have a really great thing going.
Oh, well, you know what? I have fun in doing what I do.
Exactly.
So,
well, when you're passionate about something,
yeah,
it's not really
life,
work.
and life just flies by, right?
Yeah,
well,
exactly.
You're always engaged in learning and applying and trying to create a better experience. As I said, because I was so fearful. I just want to know that people can walk in and feel like it's a safe environment and that they have a voice and they can speak up and we can dialogue and I get to know them as people. It's not about their mouth, it's about who they are to empower them to a better level.
And I love that you actually bring that to the surface rather than not talk about that. Because a lot of people, a lot of dentists, I should say, are fearful to even bring that to the table about the fear factor. It's like they don't, let's not talk about fear.
Right.
Because if we talk about fear, then we're going to bring fear up. But you confront it like the elephant in the middle of the room.
Well, a lot of people say they're fearful of coming. And I say, well, what is it about? And it could be 10 different reason why, but I need to know, like, is it because you're afraid of the needle like I was, or are you afraid that, you know, that having materials in your mouth, or is it because you have a gag reflex, or is it because you feel that you might not be able to stay open long, or that you've got jaw problems? I don't know what the fear is, so we have to go a step further to understand, and then we can address it.
Usually it's change, right? I'm afraid of change,
Uh-huh.
right? Well, as a psychotherapist,
Right.
and what I usually deal with is I'm afraid to make the change.